Hi friends, do you know which group of blood group people are more susceptible for getting gastric cancers and which is the most common cause of lung cancer in non-smokers? So same like that we will be discussing about some 15 another set of questions in this series, and I am welcoming you all back to our channel, the Nurse channel, and today we will be discussing another set of 15 questions which are aimed at preparing you for the upcoming SCT examination and the JIPMER examination also. So before starting our session, let me remind you one thing. Whoever not yet subscribed our channel, kindly subscribe and kindly support us and watch the video till the end, because we are discussing 15 very important questions from different aspects of our nursing subjects, and that definitely will help you to prepare for the upcoming nursing officer exams. So once again, welcome you all back to our channel, and we will start with our questions. So 15 questions on with the detailed explanation on the JIPMER and SCT preparation. So we will move on to the questions. So we will move on to our first question in the SCT JIPMER series, and here comes the first question for you, and the question is from microbiology, and the question is, what is the approximate size of the bacterial cell? Okay, so it's a direct question. What is the approximate size of the bacterial cell? So here comes the options. The options are option number A, 1 millimeter in diameter, option number B, 0.5 to 1 micrometer in diameter, option number C, 2 millimeter in diameter, and option number D, 2 micrometer in diameter. So what is the answer? What is the approximate size of the bacterial cell? So here the two things that will confuse you is regarding the millimeter or the micrometer. So you should understand which is smaller. So then you can find out the answer for this question. So what is the answer? So definitely the answer for the question is option number B, that is 0.5 to 1 micrometer in diameter. Okay, so the answer is 0.5 to 1 micrometer in diameter. So we know that the bacteria are very small, most being approximately 0.5 to 1 micrometer in diameter. Okay, so I think that question is clear for you. Now we will move on to our next question, that is question number 2, and the question is, which human cancers have the highest mutation burden? So the question is, which human cancers have the highest mutation burden? So you should understand first what is mutation burden to answer this question. Okay, so that we will discuss in the explanation session. Now we will move on to the options for the question, and the options are, the first option AML and ALL, the second option is lung and prostate, the third option is lung and melanoma, and the final option is HCC and colon. So you can expand this. What is AML? That is acute myeloblastic leukemia, acute lymphocytic leukemia, that is ALL. So what is the answer? AML and ALL, lung and prostate cancers, lung and melanomas, or hepatocellular carcinoma and colon cancer. So among these, which human cancers have the highest mutation burden? That is a question for you. So what is the answer? So the answer is the option number C, lung and melanoma. Okay, lung cancers and melanomas have the highest mutation burden. Okay, so in the beginning I told we should understand what is a mutation burden. Okay, so what is a tumor gene mutation burden, or TMB? So you should understand this term. This is the approximate amount of gene mutation that occurs in the genome of a cancer cell. Okay, so the approximate amount of gene mutations that can happen, that can occur in the genome of a cancer cell, is termed as the tumor gene mutation burden, or the TMB. Okay, so the tumors with high mutation burden have large numbers of genetic mutations in their cells. Okay, so that is very clear. The tumors with the high mutation burden, definitely they will have large numbers of genetic mutations in their cells. So our question here was, which human cancers have the highest mutation burden, and that is, the answer is the lung and melanomas. Okay, so I think the second question from the oncology also is very clear for you now. Now we will move on to the third question in our series. The question is from the nutrition, and the question is very simple question: vitamin D deficiency causes dash. So it's a direct question. Vitamin D deficiency causes dash. Now we will see the options for the question, and the options are, the first option is osteoporosis, The second option is hemophilia. The third option is TB, and the final option is osteomalacia. So the question was very simple, but the options, it may confuse you between the option A and D, and definitely you know that the option number B and C don't have any connection with this question. Okay, so the options are osteoporosis, hemophilia, TB, and osteomalacia. So I have given you a clue. So what is the answer for the question? Vitamin D deficiency causes dash. So you know that the answer is definitely option number D, that is osteomalacia. Okay, so what is osteoporosis, what is osteomalacia, that we will see in the explanation of this question. So we know that osteomalacia refers to a marked softening of the bones, most often caused by severe vitamin D deficiency. Okay, so the vitamin D deficiency can result in a condition called osteomalacia, in which there will be marked softening of the bones will happen. Okay, so that is due to vitamin D deficiency. Though the confusing option was osteoporosis. So what is osteoporosis? So you know that it is a condition in which bones become weak and brittle, and it is due to the lifelong lack of calcium plays a role in the development of osteoporosis. So osteoporosis due to the deficiency or a chronic deficiency of calcium, and osteomalacia is because of the deficiency of vitamin D. Okay, so you are getting answer for 2 questions from this one question. So I think this question also is very clear for you. Now we will move on to our next question, that is question number 4. So the question number 4 is, the ideal cancer biomarkers should have which of the following qualities? So the question is regarding the cancer biomarkers. So the question is, which are the characteristics, which are the qualities of the cancer biomarkers? And the options for you are, the first option is option number A, high analytical validity. Option number B, high clinical validity. And option number C, high clinical utility. And the final option is all of the above options. So what is the answer? So the question is very clear, which all are the qualities, which of the following are the qualities for an ideal cancer biomarker? So the options are high analytical validity, high clinical validity, high clinical utility, and all of the above. So what is the answer? So definitely you know that the answer for this question is all of the above. So what all options what we have mentioned here, like high analytical validity, high clinical validity, and high clinical utility, all these things are the qualities of an ideal cancer biomarker. So we should know first what is a cancer biomarker. So that we will discuss now. What is cancer biomarker? So you know that a cancer biomarker refers to a substance or process that is indicative of the presence of cancer in the body. Okay, so these cancer biomarkers can be referred to as any substance or any process that is indicative of the presence of cancer cell in our body. Okay, so now we will see which are the types of biomarkers. Okay, so this also is very, very important. So we have nearly 5 types, like molecular biomarkers are there, histologic biomarkers are there, then radiographic biomarkers are there, and finally the physiological characteristics biomarkers. So there are 4 types of biomarkers, that is molecular, histological, radiographic, and physiological characteristics biomarkers. Okay, so that's all about the biomarkers, and the qualities they have to possess are explained in the question. Okay, so that is related to cancer biomarkers. Okay, so now we will move on to our next question in this series, that is question number 5. The question is, the main excitatory neurotransmitter in the central nervous system is. So the question is very simple and very direct. Which is the main excitatory neurotransmitter in the central nervous system? That is a question. So the options are, the question option number A, GABA, option number B, acetylcholine, option number C, aspartate, and option number D, glutamate. Okay, so think about the neurotransmitters, and in that we know that we have 2 types of neurotransmitters, that is excitatory neurotransmitters are there and inhibitory neurotransmitters are there. So in this, the question have asked regarding the excitatory neurotransmitter, that is the main excitatory neurotransmitter in the central nervous system. So what is the answer? Among these options, what is the answer? So definitely the answer is option number D, that is glutamate. Glutamate is the main excitatory neurotransmitter in the central nervous system. So we will see the explanation for this question. So we know that gamma aminobutyric acid, or the GABA. So the first option was regarding the GABA. It is an amino acid that functions as the primary inhibitory neurotransmitter. So our question was regarding excitatory neurotransmitter, but GABA is an inhibitory neurotransmitter of the central nervous system. Okay. So the next option was regarding the acetylcholine. This is another important neurotransmitter that you know that it is also a major excitatory neurotransmitter in the hypothalamus in vitro in the absence of glutamate excitation. Okay, whenever there is an absence of glutamate excitation, glutamate is the answer for our question. So whenever there is an absence of glutamate excitation, then the next one to act is the acetylcholine. So the main thing is the glutamate, then only comes the acetylcholine. Okay, so acetylcholine also is an excitatory neurotransmitter. Okay, so the another option was the aspartate was there. Okay, so aspartate and this glutamate, almost they are equal to their effects, but the main excitatory neurotransmitter in the central nervous system is always, that is a glutamate. Glutamate, aspartate and acetylcholine all have similar functions. Okay, so now we will move on to the next question in our series, that is the sixth question. This is from the cardiovascular system, and the question is: the coronary veins drains the deoxygenated blood from the heart into the dash. So the question is very clear. The coronary veins drains the deoxygenated blood from the heart into the dash. So what is the answer? So just to think about the anatomy of the heart, the blood supply of the heart, the venous supply of the heart. Okay, the coronary veins. What is coronary veins? Coronary sinus. Those things you have to keep in your mind and see the options for the question. The first option is option number A, left atrium. Option number B, right atrium. Option number C, superior vena cava. Option number D, inferior vena cava. So what is the answer? Coronary veins will drain the deoxygenated blood into where? So which is the answer? Left atrium, right atrium, superior vena cava, inferior vena cava. So what is the answer? So it's a simple question, and you know that the answer is definitely the option number C, that is right atrium. Okay, right atrium is the answer for this question. So we will see that coronary sinus, you know that the coronary sinus serves as the primary collector of cardiac venous blood, and it is located in the atrioventricular groove on the diaphragmatic surface of the heart. Okay, so the coronary sinus, you know that it serves as the primary collector of cardiac venous blood, and where it is located in the atrioventricular groove, and it is on the diaphragmatic surface of the heart. Okay, so you know that the coronary, our question was the coronary sinus, this will empty the blood directly into the right atrium. Okay, so that was a very simple question. So we will move on to the next question in our series, that is the question number 7. The question is: which of the following is the most common cause of lung cancer in non-smokers? Okay, so the question, you should be very careful, and you should see that the question is asked about the lung cancer, and the question is the most common cause of lung cancer in non-smokers. Okay, so we know that one of the main reasons for the development of lung cancer is smoking. Okay, chronic smokers are prone to get lung cancer. So apart from the if the patient is a non-smoker, still the patient is prone to getting the lung cancer, means then what is the cause? So that is a question for you, and the options are: the first one is asbestosis, the second one is the silicosis, the third one is the radon gas, and the final option is the beryllium exposure. So all the options, you know that all these are the occupational hazards. Okay, occupational lung diseases, all these things are the occupational lung diseases, and among these, which can cause the lung cancer in non-smokers? Okay, so that's a question for you. So what is the answer? Asbestosis, silicosis, radon gas, beryllium exposure. So here the answer is option number C, radon gas. Okay, radon gas is the most common cause of lung cancer in non-smokers. Okay, so we will see the other options that are also very, very important. The first, one of the options was silicosis. So what is a silicosis? You know that silicosis is a long-term lung disease caused by inhaling large amount of crystalline silica dust. Okay, so inhaling large amount of crystalline silica dust can result in the development of silicosis. So that another option was radon, which is the answer for our question. And you know that radon is the #1 cause of lung cancer among non-smokers. And radon is a radioactive gas that forms naturally when uranium, thorium, or radium, which are radioactive metals, break down in the rocks, soil, and groundwater. Okay, so who are working in the mine areas, in the works related to the rock, soil, etc. There are chances of exposure to the radon gases, where it is a radioactive gas that is formed naturally when the uranium, thorium, or the radium are when they are getting breaking down, which are happening especially in the workers who are working with the metals breakdown in the rocks, soil, and groundwater. Okay, so that's the answer for our question. And one more option was there, that is regarding the chronic beryllium disease or the beryllium exposure. So what is CBD or chronic beryllium disease? So chronic, it is a chronic granulomatous lung disease caused by inhaling airborne beryllium after becoming sensitized to beryllium. Okay, so long-term exposure to the beryllium can result in a granulomatous lung disease, which is a chronic disease known as the chronic beryllium disease. Okay, and one more option was there, that is asbestosis. You know that it is a serious lung condition caused by long-term exposure to asbestos. Okay, so from this question we are getting answer for many, we are getting points of so many other occupational lung diseases. Okay, so I think this question also is very clear for you. Now we will move on to our 8th question in this series, that is question number 8. Cryptococcosis is a disease of. Okay, so this is regarding a disease, that is cryptococcosis. So what is cryptococcosis? That is a question. So the option is, it's a viral infection. Option number A, viral infection. Option number B, mycotic infection. Option number C, parasitic infection. And option number D, bacterial infection. So what is the answer? Cryptococcosis is what's the answer? So definitely the option number B is the answer for the question. It's a mycotic infection. Okay, cryptococcosis is a mycotic infection. So we will see what is a cryptococcosis. So we know that cryptococcosis neoformans is an important basidiomycetes pathogen of humans causing the cryptococcosis. Okay, so from the first line itself we are getting so many information, like cryptococcosis is a disease caused by Cryptococcus neoformans. Okay, so it is a coming under the group basidiomycetes. Okay, and it is a generalized mycotic infection involving the bloodstream as well as lungs, central nervous system, and other organs. Okay, so cryptococcosis is a generalized mycotic infection which involves which can affect the blood streams, then the lungs, central nervous system, and other organs, which is caused by Cryptococcus neoformans. It is coming under the group of basidiomycetes. Okay, so I think regarding cryptococcosis you get a brief knowledge, right? So we will move on to our next question, that is the question number 9, and it is from the nutrition, and it is regarding an abbreviation. What is MDD? MDD in nutrition stands for. So the question is a simple direct question, but it's quite confusing. We will see the options. What is MDD? Expand MDD. So the options are: option number A, milk deficiency diseases. Option number B, mineral deficiency diseases. Option number C, micro deficiency defect. And option number D, malnutrition defect diseases. Okay, so it's quite confusing question. So what is the answer? MDD in nutrition stands for. So here the answer is option number B, that is mineral deficiency disease, that is MDD, mineral deficiency disease. So from the name itself it is clear what is mineral deficiency disease. So you know that mineral deficiency means it includes all the minerals, all the essential minerals, and whenever there is a deficiency of any of the minerals, and it can be classified under the disease, that is a mineral deficiency diseases. Okay, this is just a small information for you. So now we'll move on to the 10th question in our series. The 10th question is, which was the first disease for which a chemotherapeutic agent was used? Okay, so very important question. So the first disease for which a chemotherapeutic agent was used, that's a question for you. And options are: the first one is smallpox, the second one is syphilis, the third option is AIDS, and the final option is malaria. So for which disease the first chemotherapeutic agent was used? That's a question for you. Direct question, but very important. So what is the answer? So the answer is option number B, syphilis. Syphilis was the first disease for which a chemotherapeutic agent was used. So we will see some information, very, very important information. You know that syphilis is the first known disease for which a chemotherapeutic agent was used, and an arsenical compound known as salvarsan was synthesized by Paul Ehrlich in 1910 to treat this disease. Okay, so you are getting informations like syphilis is the first disease for which a chemotherapeutic agent is used, and the agent was a salvarsan, and it was an arsenic compound, and it was used by Paul Ehrlich in the year 1910. Okay, so very informative question for you. And now we will move on to our 11th question, that is from the psychiatry. Very simple question. Cognition is dash. Very simple direct question. Cognition is dash. So the options are, it's perception, second one is thought, third one is behavior, and the final option is feeling. So what is a cognition? What is the answer? So you know that the answer is definitely option number B, that is thought. Cognition is related to thought. Then you know that cognition is related to the thinking. Cognition means it is related to action, and affect means it is related to feelings. Okay, affect is feeling, cognition is action, and cognition is thinking. Okay, it's a basic psychiatry. So now we will move on to our next question in this series, that is the 12th question. Vaccination was invented by who? The question is very simple, direct question from the community health nursing. Vaccination was invented by whom? The options are option number A, Watson, option number B, Jenner, option number C, Crick, and the final option number D, Pasteur. So who invented vaccination? So definitely the answer is option number B, Jenner. Then we will see the other important personalities what we have mentioned in the options in the explanation session for this question. So first we will see about the Jenner, and in 1796 he first vaccinated an 8-year-old boy with materials removed from the cow, and it gave protection against the smallpox virus. Okay, so the first vaccine was against the protection against the smallpox virus, and it was discovered by Jenner in the year 1796, and the materials were removed from the cow, and it was used in an 8-year-old boy. Okay, so the other thing is, other important personalities what we have discussed in the options, that is Watson and Crick. So they are well known for the discovery of the DNA double helix. Okay, so the discovery of the DNA double helix was done by Watson and Crick, and Louis Pasteur, definitely you know that he is the father of microbiology. Okay, so Jenner invented the first vaccination, DNA double helix was invented by the Watson and the Crick, and the Pasteur is known as the father of microbiology. Okay, so that question also is very, very informative. Now we will move on to the 13th question in our series. The question is all from the mental status examination session. The mental state examination include the following except. So question, you should be very careful. Mental status examination include all except. Okay, so the options are A, appearance, B, thought, C, cognition, and D, diagnosis. Okay, so mental status examination include the following except. So the options are appearance, thought, cognition, diagnosis. So what is the answer? Which is not included in the mental status examination, MSc. So definitely the answer is option number D, that is diagnosis. So we see what are the subcategories, what all things are included in the MSc, that is a mental status examination, can be divided into the following major categories, which include, the first one is the general appearance of the patient, then second one is finding out the emotions of the patient, then to check the thoughts of the patient, then cognition, and finally judgment and insight. Okay, so these 5 categories are there in the MSc, like general appearance, emotions, thoughts, cognition, judgment and insight. Okay, and in this, diagnosis is not a part. So diagnosis is the answer for the question I have asked. Okay, now we will move on to the next question, that is the second last question in our series. The question is, which of the following is not a risk factor for gastric cancer? Okay, the question should be very careful. Which of the following is not a risk factor for gastric cancer? So the options are, the first option is type A blood groups, option number B, lack of refrigeration, option number C, cigarette smoking, and final option number D, type O blood group. Okay, so which of the following is not a risk factor of gastric cancer? So what is the answer? This is also a very, very informative question. and the answer is type O blood group. Okay, so type O blood group people are not, it's not a risk factor for the gastric cancer. The other three what we have mentioned here, that is the type A blood group, lack of refrigeration, cigarette smoking, all these things are risk factors for the development of gastric cancer. So now we have to understand why type A blood group people are more susceptible for gastric cancer. Then we will see in the explanation of this question. So we know that the people with type A blood group are more prone to be infected by the Helicobacter pylori than other ABO blood type individuals, whereas a slightly decreased risk of gastric cancer was identified in blood type O individuals. Okay, so it is very clear now. So type A blood group people are more susceptible to be get infected with H. pylori. You know that one of the main reasons for the development of cancers, gastric cancers, are the frequent and the chronic infections with the Helicobacter pylori. So the type A blood group people are more prone to get Helicobacter pylori infections, and they are more susceptible for the development of gastric cancers. Whereas in the other side, type O individuals, it has shown that they have the slightly decreased risk of development of gastric cancer. Okay, so that was a very informative and very important question for you. Now we will move on to our last question, the last question in our series, that is regarding the baroreceptors, and the question is, baroreceptors are situated in, where the baroreceptors are situated. Okay, so baro, from the name itself it is clear that baro, it is related to the pressure. So these receptors, where it is situated. So the options for you are, the first option is at the arch of aorta and the carotid sinus, in the right atrium, in the liver, in the brainstem. So these are the four options for you. The options are at the arch of aorta and the carotid sinus, in the right atrium, that is the second option, the third option in the liver, and the final option is in the brainstem. So where the baroreceptors are situated. So this is also a very simple question, and you know that it is situated in the arch of aorta and the carotid sinuses. Okay, and you know the importance of baroreceptors in maintaining the blood pressure of the individuals, and we will see what is a baroreceptor. These baroreceptors are mechanoreceptors that provide the brain with information pertaining to the blood volume and pressure by detecting the level of stretch on the vascular walls. Okay, so whenever there is a you know that whenever there is a blood volume increase, or when there is a pressure is increasing, these baroreceptors will be stretched, and which is situated in the arch of aorta and the other area what we have mentioned. These receptors will be sensitized, and it will give sensations to the brain, and accordingly the blood pressure will be maintained. Okay, so that was the final question for you in the in our series. So so far we have discussed about the 15 questions from various areas of our nursing subjects, and these questions are very important. So keep in touch with us, and we will come up with another important video with another 15 or 16 questions very shortly. So be in touch with us, and keep studying. Okay, so once again, thank you for watching the video till the end, and thank you.